Hey everyone, this is Dr. Valachi coming to you here from our pretty empty office. As you guys know, we're still kind of under lockdown and unable to see patients face to face unless there's some kind of an emergent issue. We've been spending some time doing a little redecorating in our office, including this beautiful collage of the famous maple from the Japanese gardens. This might be as close as we can get to it for a little while, but I know the weather's been really nice, and I hope that you and your family have been able to at least get outdoors and enjoy some of the beautiful weather and battle some of the cabin fever that I know we've all been dealing with. I wanted to let you all know that one of the other important things that we're trying to work on and starting to implement is the use of telemedicine. We're probably going to be seeing patients face-to-face less frequently than we have in the past. And relying more on virtual visits, which actually our practice it lent itself well to that type of an appointment. So I've attached a link to an article here which explains a little bit in general terms about telemedicine itself for your information. The site that we've settled on is called doxy.me. And I've also attached a link to the Doxy site so you can familiarize yourselves a little bit with the system that we're going to be using probably with you. I have had the pleasure of having a few of these telemedicine visits already with some of our patients. It's actually really easy to navigate, both from the patient standpoint and for us doctors. It has been running a little bit slow, and I suspect that that's because so many doctors are starting to use telemedicine more because of the COVID pandemic. It is a HIPAA compliant site, so you can be confident that your medical information will be secure when we're using the telemedicine visits. For right now, I'm doing the calls myself, but we're also working on protocols and learning the system so we can have support staff, one of our assistants or other staff handle some of the calls either partially or on their own, depending on what your individual needs might be. So I'm really excited about this telemedicine concept and implementing it into our practice. I think it's going to be one of the silver linings of this otherwise really terrible circumstance that we're finding ourselves in. The other thing I wanted to let you guys know about is a project that I'm working on with some friends of mine. I'm in a Dental Sleep Medicine mastermind group. So there are 22 of us across the country, all the way from New York to Alabama, Michigan, out here to the Pacific Northwest. And we're starting to work on a book together. One of the things that we've discussed from time to time is that a lot of the information about sleep apnea that's out there is really a